going to do. The goal that we have is lofty at Sylvester Comprehensive Cancer Center. We have partnered with and I'm just going to say just a little bit of an introduction, but with the World Health Organization to completely eliminate cervical cancer from the world by the year 2030. And that started 3 years ago and it's continuing on right now. Please eat while we talk, ask questions. I'm going to introduce Lily Lopez. She is the president and CEO of the South Florida Hispanic Chamber. She has been such a great partner for Sylvester and health in general, and a wonderful mentor and a community connector and activist. So it is thanks to her that we were able to bring everyone together here at the University of Miami. So she's going to say a few words. So thank you, Lily, and thank you.
Especially if it's related to something that really affects women's health. And Dr. Kobetz has been a recipient of Chamber Awards. She has been a speaker. Every time we need her, this lady is there. So Dr. Kobetz, thank you so very much. Always.
Do you want to listen in and see how the women's world works? We do have some members of the board here. Can you stand up for a minute, though, please?
Which was mostly signed with children whose parents are incarcerated. Is that correct? Yes. Thank you so much, my friend. And we're very happy to support them, especially now in this holiday season. This wonderful chat will support children of incarcerated parents with tutoring, programming, and a lot of fun activities, including our therapy and social workers to help them through difficult times. I'm so thrilled and happy to accept this check from my dear friend and a wonderful organization. Thank you so much.
Was really happy to come home, but actually knew very little of the local cancer landscape. Didn't understand how it was distributed across people or places. And I decided that if I was going to do this work and do routine screening, we all have the possibility of eliminating cervical cancer. And that's something that any of us, if we could have a crystal ball and make that commitment to our children and their children, we would do it without. And so when I started working in cervical cancer, it gave me hope. Lots of hope. That if I got a group of really powerful women and men behind me, that together we could do something extraordinary. There are a number of buildings that are lit up in Teal in solidarity for our shared commitment to be that light, to be that hope, to lead the way in making cervical cancer something that we remember. Like UM is not my alma mater, it is my alma mater by choice. This place has allowed me to dream beyond boundary. And so when I found that disparity in Little Haiti, and then worked with very established faculty to build the university's campus community partnership of how to get our health systems ready to meet the demand. University of Miami opened that door. 100%. We have someone from Rick Scott's office here. Now, Rick Scott. Which is the most common sexually transmitted infection worldwide. I mean, really, probably all of us have had it in our lifetime, and most of us never know because our body successfully fights off the infection without there being any symptoms or issues that we have to navigate as part of our healthcare systematic. Because if I could tell you that I could give your child, girls and boys, a vaccine that would prevent them from developing 7 types of cancer, I don't think any of you would pause. I'm certain you wouldn't. Maybe some people have vaccination allergies, some people have some reticence around vaccines. I get it. But most people would lean into that opportunity because we don't ever want EV lives all over the urogenital tract of men and women. So you don't actually even need to have intercourse to be exposed. And unlike other sexually transmitted infections, things like condoms don't offer a whole ton of prevention. They don't. And nobody is willing to talk about this. So what happened with the HPV vaccine is because it became associated with a sexually transmitted infection, and because sex is such a polarizing topic, there were many people who decided, I will not vaccinate my child. And when you start to dig into why, a lot of it is connected.
And right, you like my response?
I'm sure they do.
You know what, because I'm not a scientist, so I'm just saying like it is.
So one of the things that
They like it, I mean, it kept me there, I mean, after 5, 6 years.
I would love each one of us today to sign a pledge, right? It's a pledge, right? It's nothing too serious, but a pledge saying that you will tell 10 other women what we learned today and help spread the message, help amplify what Sylvester is doing and what the University of Miami is doing. And I think that this is a very actionable step to prevention, and we'll be able to see results. So the pledge is here. So as we get more sushi.
What was the third one?
Oh,